So let's take a look at some research. And again, as I said, I think it's really important to understand the why. If you don't understand the why, then you can't develop a strategy or a technique. And I think most of us are guilty, frankly, of attending courses that are techniques and it's see this, do that. And as a result, we don't really understand the why. So hopefully I'll give you some strong why. And then as a clinician, you can do the things you do in addition to what I may suggest. So if you see patients with neck pain, what we see is that if you look at the title of this study, that a reduction of cervical and respiratory muscle strength in patients with chronic non-specific neck pain. So it turns out that in this study that if you had moderate to severe neck disability, there was a high likelihood of cervical and respiratory strength issues. So the bottom line that's really cool about this study is that a simple measurement of neck strength could be a proxy or a predictor of respiratory function in patients with chronic and moderate neck pain. So I don't know how many of you use a dynamometer to measure neck strength or look at some total neck deep chin tuck resistance time off of a table or those type of things. But if you're not, in your chronic neck pain patients, I would encourage you to do so. And what you'll find is profound weakness in these, not only maybe in the endurance, but also the strength. And as this paper points out, it can be a proxy for respiratory weakness as well, which is neat because we find that training the respiration can positively impact the neck pain. So again, here's a respiratory weakness in patients with chronic neck pain. And what they show is that, once again, that the neck muscle strength was the only predictor that remained significant in the prediction of expiratory and inspiratory pressures. So your ability to inhale and exhale was directly linked or predicted by the strength of your neck. And interestingly enough, I had a patient in this morning. She was in a hit and run accident. She was rear-ended, so she has sort of a whiplash-associated disorder, headaches, and a variety of other things. And she also has COPD. So what was fascinating to me is obviously she has difficulty with her respiration. When we checked her neck strength, it was almost non-existent. She could barely hold her neck up against gravity. So it's interesting, again, in this population because she has not been doing as much diaphragmatic strengthening as she might need to be doing for her COPD, and secondarily has this underlying weak neck, gets in an accident, and is only that much more susceptible. So anyway, I just thought it was an interesting corollary that came in this morning. This is talking about FHP as forward head posture, the effects of forward head posture on expiratory muscle strength in chronic neck pain patients. And again, what you can see is that forward head posture is associated with expiratory muscle weakness in chronic neck pain patients. And although these tests may not be specific to muscle weakness when you're looking at respiratory function tests, it turns out that interventions about forward head posture and neck pain should focus on the effects of respiratory muscle training. So here's a paper that's actually saying treating the respiratory system and respiratory muscle training is a way for us to address this forward head posture and work on these chronic neck pain patients. So hopefully I'm starting to paint a case for those of you that see patients with neck pain that if you're not evaluating their breathing and quantifying it, not just respirations, but the strength of it, that there's a big opportunity on the table and to see really lasting changes. And that additionally, that neck muscle weakness is a great proxy for diaphragmatic weakness. So what is the impact of this forward head posture? And this is interesting because again, we're trying to link the neck to the diaphragm here. This is a great paper. I encourage all of you to download it and read it thoroughly. I think it applies to anyone in the chiropractic, physical therapy, massage, acupuncture, athletic training world. But we see that forward head posture can have an effect on the respiratory system, as we've been talking, muscle activation, proprioception, balance, and frankly on neck pain. And this is how we look to quantify it. So I do not take films in my office, but if you were to take a film, you could take the perpendicular distance between the vertical line of the posterior inferior corner of C7 and the vertical line of C2 and measure that. And the average should be 15 millimeters. I think an easier way to measure this is with what's called a cranial vertebral angle, and this is what I use. So